So all these people that are like biohacking and getting in and out of cold and plunges, what I hear is those are great if you want to like slow down aging, but let's start with the basics. What should your hemoglobin be? So talk a little bit about what we've thrown out some numbers here. So under what ideal is 4.5 and what is considered you better get to work. Here's where I want to start. And I just, my audience, for those of you listening, if you don't know Dr. Boz, you are going to love this conversation. And one of the things I want to say that's really fun about connecting with you is that you and I are both educated on YouTube, which is a whole nother platform to educate on. And I feel like having a mission and a focus of what I'm trying to do with my videos really, really keeps me on point. And I see that in you too. So can you start a little bit about your mission and why you are putting these videos out on YouTube? Because it is not for your own self. I know that.
Right. Yeah. I was looking at the budget the halfway through the year for YouTube. And I'm like, it is not a money generator.
No, it's not. It's not for that. Definitely.
Absolutely. No, honestly, I think it helps as a way of introduction to just the answer to the question has roots into my soul. I am a hog farmer's daughter. I've castrated more pigs than you've probably eaten. I have I'm 5th generation farm daughter. And I can remember the day that I didn't want to raise hogs for my whole life. I wanted something bigger. I wanted out of here. This town is too small, 800 people, 21 in my kindergarten class, the same 21 in my senior class. What I was missing, dreaming about was this drive to just not be there. And that drive led through lots of long hours of becoming a physician, something I had no mentorship for. I had no idea what I was saying yes to. And praise be to God, I had just enough scholarships at the right time to get the bills paid and then get into medical school. And it was life-changing. It was truly a different world that I knew I wasn't going to do hog chores, but there was a lot of this world that was not lovely. I had worked in a nursing home. Aging wasn't the problem. Taking care of humans, loving on them, that's not the problem. The side effect of growing up in a community of 800 people is you hold a huge responsibility, whether you want to or not, about being a community member. And are you helping the community or are you not? I don't know how to not think that way.
Yeah.
So as a young budding physician, there's this choice point in the second year of medical school that says, well, what kind of physician do you want to be? And I'm like, oh my goodness, another life decision. And I can look around to see these other physicians now as role models. And I knew that the internal medicine team, they were super nerdy. They did not have much of a personality, but they knew all the answers to the questions my parents were asking. And the elders that I knew and loved, whenever I wanted to answer their questions, I knew that I should be asking an internist to figure that out. So as I became an internal medicine physician, I had these aspirations of if you go to, internists don't have a good marketing team. It's a terrible name. Like, you take care of the internal part.
Yeah, it is a horrible name. Very vague.
Right. And you're like, what? But what it really boils down to is that we are the problem solvers. We're supposed to have the most complex problems that we think about at the deepest level of science, plus medicine, plus mind, body, spirit, and translate that into, if you go to an internist and they can't figure out what's wrong with you, you're going to die.
Ooh.
Yeah.
Yeah. That's a huge responsibility.
And so I love the complexity. I love the analytics. I was really attracted to shock trauma because you could calculate a lot of the answers and it seemed black and white. And then I had a baby on time as planned, but decided I wasn't going to spend the life there. I was going to go to outpatient world and be a physician that didn't have 120 hours a week. And I loved that decision, but I brought to the clinical world of outpatient a very analytical approach of how do you reverse problems? How do you actually get outcomes that improve the patient? I quickly learned that if you don't take care of their brain first, you're never going to get their diabetes to be better. And I became what most internists are, is the management of chronic problems. And there is a very strategic way that if you want to have long-term best outcomes, brains must be healed. Mental and physical brain must be healed first. That spiritual role is not an absent part of medicine. It is truly part of healing. But if you wanted to reverse them quickly, you could, at least I was taught that you could write a lot of prescriptions. And about the third or fourth year into what I thought is a very exciting outpatient career, we were doing really amazing things. And I'd been invited to the White House for taking care of a patient population that was very impoverished, but was getting outcomes at a strategically low cost. And it was because of this analytical thing I was doing in the outpatient world. But outside of those innovative lanes in medicine, I was matching patients to prescriptions. If you have this symptom, I give you this pill. If that pill doesn't work, then I give you a different pill. If those two pills don't work, then I test these three things, then I give you either that pill or this pill. And it was just a matching game of these prescriptions, and it was awful.
Yeah.
This is not what I want. This is terrible.
Right.
And then you get into the pay for performance in medicine, which had a lot of great things when you looked at the theory, but the application of it became, if they have this diagnosis in their chart, you must have them on these prescriptions. And you're like, no.
Like they were telling you what to prescribe.
I got paid to do that. I mean, you're Medicare, Medicaid, you're now getting incentivized a few more pennies. It wasn't a lot, but you don't get into medical school if you're not competitive.
Yeah, right. There you go.
So I'm like, oh, I want to be the best.
Yeah.
What do you mean? The best is the one who matches them up the easiest? Well, send out an email, send out an APB. You don't need to see me to get on the prescription. And then you just see medicine is broken. Like I can remember the first time I got written up when they're telling me I have to have this game of match up the patients to all these prescriptions. And again, this is 2002, 2005, right in that zone. And I'm still writing statins for every LDL cholesterol. It's over 160 and, doing all the things the rules say. But there was a patient in there that was a young mom. I'd seen her every year for the last 5 years, and she was fine. She was raising her babies and doing a good job of being a good mom. And she needed her thyroid refilled, and she had no symptoms, no troubles. And she writes in saying, can't you just refill it? And I said, well, here, I'll go to the lab, get your blood tested, and I'll send you a portal message, secure and private, that about what the labs are. And if it's fine, we'll refill it for a year. You come in when you need to see me. And I got taken up to the highest level in the shiny shoes of the corporate medicine saying, And in fact, they said, that's illegal. I'm like, what's illegal? Like, you cannot write a prescription without seeing the patient. I said, yes, I can.
Yeah. Yeah.
That's what my degree is for.
Right.
And so, of course, it came down to that you couldn't collect the copay if I just did the lab. And we don't make money on labs. People think we make money on labs. No, the labs make money on labs. I make money when I see you.
Right.
And I'm a thinking doctor, so I don't make that much money. They do not pay you for thinking. They pay you
Crazy.
for cutting or procedures.
And when you say they, you mean the insurance companies, just so people are clear that that's driving those decisions.
Right. Insurance companies have a pay for performance, but it's incentivized by the government's pay for performance. And it had a great initial thought, which was, let's measure physicians for their outcomes. I'm like, okay.
Right.
And then the outcomes got bastardized because they said, well, let's just do the easy analytical thing because there's so many doctors, we wouldn't want to actually know the physician and their practice. Let's put a spreadsheet together to say, if their A1c is this, are they on insulin?
Right.
Right. If they have a diagnosis of diabetes, do you have them on a statin? No questions asked.
Yeah. Right. It's just a one-to-one, one pill, one problem situation. Yeah. So
my goal, my mission,
is to not do that. Your mission is to not do that.
I started so many prescriptions in the first 18 years of seeing patients before I flipped my clinic to a ketogenic based, start with a diet before you start with pills. That I want to stop as many prescriptions in the next 20 years as I started in the first. And that's a lot of prescriptions.
Yeah. I heard you say that. I just want to say that I heard you say that at KetoCon. And I too am one of those people that I just think about the community nonstop. I think I'd like to think about myself a little bit more, but I can't. I get more of a dopamine rush trying to help other people. And so when I heard you say that at KetoCon, that you're trying to get people off as many prescriptions as you put them on, I was like immediately in love with you. And like these are the kind of messages that need to get out there. And the second thing that you said that really blew my mind is that in the ketogenic world, we talk so much about mitochondria and ketones, but I love what you have to say about hemoglobin A1c and the red blood cell. And I feel like that conversation needs to be brought to the surface. So can you talk a little bit about why hemoglobin A1c, if we could just look at that number and understand that number, we could end chronic disease?
Well, it truly dovetails into the story I just told, where I was definitely, one of the biggest judgments you had was how low could you get your A1Cs for these patients with chronic illness. In the first algorithm, it was only diabetics, and getting them below 6 was like considered impossible. And of course, if you're only using prescription medications, you never could get them there.
Yep. You could wait, pause for a second. You can't get a patient below 6 on a prescription medication. Yet we know like below 5 is for longevity.
Yes, absolutely.
Okay. I just didn't want to lose that point because that's huge. Go ahead.
Real. And I'll tell you who knows this is every actuary table, every lab or insurance. Well, if they get to sweep labs, you give them permission to sweep labs from your EMR, electronic medical record. And that means that even if they weren't the one that paid for it or ordered it, it's in your history, and they can plot your life expectancy based on A1C. And especially, I mean, it is so linear that of the health problems that are associated with it, that when we can get it below 5, you win. If we can get it to 4.5, that's my personal goal. You win. The amount of longevity and improvements in the way the system can transition from one fuel to the next, can repair an injury, can suppress the growth of a cancer. All those things seemed like woo-woo science until you really look at the association of the chronic number of blood sugar. What is the chronic blood sugar? And so when you learn about what hemoglobin A1c is in medical school, and then you get out into the real world and you see doctors being really passionate, like, hey, you got to get this better. You got to get this better. And I can remember we got to get this number down. And it wasn't the incentives that were doing it. It's because if you watch this number, it is such a correlation for who's going to have a heart attack in the next year, who's going to have a stroke in the next year, who's going to break their hip in the next year.
Right.
I mean, it predicts life. So when you look at the first time I ever explained it to medical students, I thought, oh, I should write that down. And I just put out the video in this, like my speaking season this year was all teaching about hemoglobin A1c.
It was awesome too, by the way. It was such a good talk.
So you say, hey, guess what? These hemoglobins are proteins. They are proteins that are designed to carry the most valuable commodity in your body, oxygen, to the tissues. Because if you just let oxygen float willy-nilly inside the blood, it's going to dissolve into the closest cell. It's going to go, oxygen is wanted by every cell, and it can't function without it. The delivery of the oxygen is related to, well, how well do your red blood cells get it there? So in part, that is, are your blood vessels blocked with a bunch of calcified plaques? Do you have low red blood cell count in the name of anemia? Are your red blood cells wimpy and really tiny because you're low on iron? And so there's several places where you can say, well, the delivery of the oxygen is based on that. But more importantly, how many of these proteins do you wipe out day one in a blood sugar that's too high? Mm-hmm. And that's because red blood cells, unlike many other cells in the body, they do not have a nucleus. They do not have mitochondria. They are permeable to glucose, meaning the glucose can come in and out of that red blood cell without anybody helping it. Nothing stops it. It does, like your muscle cells, you got to lift it in there. Your brain cells, you got to lift it in there. You've got a receptor that's going to take it from the outside to the inside. But red blood cells are not like that. They're permeable. They are openly permeable to glucose. So as the glucose, the concentration in your blood is the same concentration that's inside that red blood cell. And if that glucose gets too close to a hemoglobin, splat, it lands on the hemoglobin, and like gum to the bottom of your shoe, it is stuck for the life of that hemoglobin.
Oh, wow.
So, yes. So that red blood cell is going to last 100 days, 120 days in most of us. And until you recycle it through the spleen and you tear down all the parts and then rebuild it in the bone marrow, it's that glucose is in the parking spot that's supposed to carry oxygen. And now you can't, you wipe that out for the full 120 days.
And
so when we
I just want to point out so that people understand, if you can't get oxygen into your red blood cell, tell us what like fatigue, pain, like all these things that people are dealing with. So explain that piece.
So as the oxygen goes inside that red blood cell, the red blood cell goes to every part of your body. So the first one that I think of is in a diabetic. You will know that when they get a sore on the bottom of their foot, and everybody says, "What's your A1c? What's your A1c? What's your A1c?" And it's because every doctor knows that if we want to fix that sore on the bottom of their foot, we need the white blood cells to get oxygen. Well, how are we going to do that? We need to know that the red blood cells getting to that infection are giving them oxygen. We need to know that the tissue that is necrotic, that is rotting for all other purposes, is going to get oxygen so that it can repair. So that the skin cells that are supposed to weave through and reset that wound, it needs oxygen. That it's tingly and the nerves hurt is because that nerve needs oxygen and it is delivered by that red blood cell. So when the red blood cell is full of sugar and its carrying seats for oxygen are all filled with gum, they're gummed up, your delivery is lower. You cannot have, the amount of energy it just takes to run your brain, your heart, your immune system, the exchange of how do I, take care of that little nick in the lining of a nerve that's on your left arm because you were living. Something goes wrong every day in these cells, and the way you repair it has to do with how well the oxygen is delivered to those mitochondria, and that is based on your average blood sugar. Step one.
Crazy. So now my brain's going to all different kinds of places. So do you know the cellular danger response? Have you heard about that? So the cellular danger response is when physical, emotional, chemical stress comes into the cell, that it gets stuck in a fight or flight type situation. And so the mitochondria stop making ATP. They actually make a signaling molecule that sends out information to all the other cells and says, hey, we have a crisis here. And so you need to shut down energy production. And in that moment, it all of your amino acids, all your minerals, all your vitamin reserves get depleted. So I'm curious if that's exactly part of what's happening here. You gum up that red blood cell, and now the body, if you're not getting oxygen into other body parts, you're going to have to start pulling not only your reserves, your vitamin, your mineral reserves, but you're also going to have to work a lot harder because your cells may be in this danger response. Do you feel like that would be accurate?
Yeah. When you look at that gumming up of the proteins that are inside a red blood cell, it's called glycation, or glucose that gets laid on stuff it doesn't belong. And although we can specifically measure the protein hemoglobin because it has this, 3-month lifespan, so we can check it frequently, every month until we get it to where we want it to be if we wanted to, knowing that we are measuring what is the last 90 days, what is the last 90 days. And if people are truly improving, even though, traditionally doctors would have you measure it every 3 months, but I find that it's too long between checks that patients lose focus of what they're doing. And checking it monthly allows you to say, hey, whatever you're doing, it's going the wrong direction. We need the average glucose to be less month after month, because it is also a predictor of how much glycation happened to, that tennis elbow that really keeps hurting and you can't seem to get it better. That white blood cell setting that they can't seem to release the cytokines and pull in the other troops to help you fight off that infection, or it gets glycated in the on position and now you're just spewing out cytokines, and that's called a cytokine storm in ways. And although glycation is a minor point of why some of those things happen, it is a chronic and stable delivery of excess sugar around the body, glycating the parts that you don't want glycated.
Yeah.
And when you look at a mitochondria that's not working right, and you get into that cellular turnover, that mitophagy, or the shutdown of a mitochondria and the rebirth of a new one, is when a mitochondria says, hey, I'm tapping out, I can't go. Glycation will do that to a mitochondria. So you watch how many things get paused, and the body will stop you. It sees danger in pushing a subset of what should be corrective functions that are in the wrong chemistry set to correct them.
Yeah.
And I contend. Go
and
ahead.
I think what's so interesting, again, I love the tennis elbow analogy, because so many people don't realize that the pain they're experiencing is lack of oxygen getting to the area to be able to heal it because of the diet that you're on that's causing too much glucose. Like, we don't make that connection. And we think of hemoglobin A1c, and I love everybody's walking around with their CGMs on now, and we're starting to see this change. But we have thought of hemoglobin A1c and fasting glucose as only something diabetics look at. But what I hear you saying is this is your tennis elbow. This is your dementia, your Alzheimer's, your memory loss. This is your menopause symptoms, because you're not getting oxygen to these areas.
It's totally exactly right. I mean, in fact, one of the hardest parts about knowing the pathology that's linked to hemoglobin A1c, as an internist, you can see chronic disease 20 years before it's coming. When you're hanging out at a 5.7 and people say, hey, I'm below 6, I'm like, you're 40. You should be at 4.7, not 5.7, which is an average blood sugar from like 90 to an average blood sugar of just under 125. So those differences are a huge amount of extra sugars floating around every minute of every day that is glycating things that are aging your body faster than they should. And even despite exercise, and when the A1c is elevated, and that predictor is how fast will you age. That's
so
one of the best ways.
So all these people that are like biohacking and getting in and out of cold and plunges, what I hear is those are great if you want to like slow down aging, but let's start with the basics. What should your hemoglobin be? So talk a little bit about what we've thrown out some numbers here. So under what ideal is 4.5, and what is considered you better get to work?
Yeah, so 4.5 is my goal for me. Again, I actually, so let's back up 1 second, saying, can you test your A1c?
Yes.
That has been off the books with the exception of a couple kits that were on Amazon for a while, but they were very specific to say you're going to have to test a few times. You're going to want to test over the course of so many months. But until May 1st, 2022, we didn't have a home point of care test. And I actually co-branded, meaning said, I want to support this company to get this information out. Again, we're not a big moneymaker, but it's a huge information place for people to go and say, can we improve their life? Yes, if they know their A1c. And so it's one of those tests where you prick the finger and you drip the blood onto the card, and then the card gets sent into an analysis. They break and look at the hemoglobins and the percentage of glycation at the alpha hemoglobin at the one position. Anyway, that's what hemoglobin A1c stands for. The point is that's always been off the books unless you wanted to pay cash to the doctor. But then again, remember, if you do that, your insurance company does get to know what that number is. And they want to know. They may not pay for it for you, but if it comes back high, especially above 5.5, they will plot you. You are plotted. And so by definition, you signed the waivers. I got to give them that information.
And what do they do with that information?
It's an actuary table. It's a prediction of disease and how much you're going to charge for your insurance. It's part of the link to.
So they'll come get you later financially, and you don't even realize it. Is that what I hear?
Yeah.
Yeah. Crazy. Okay. Where do you get this test?
Well, bozmd.com is where I've just put it on my website probably 3 weeks ago. And honestly, I did not know that it was one of my good friends from medical school when I was teaching medical school in Sioux Falls, South Dakota. His company has been looking at point of care to the patient with omega-3 and omega-6 fat.
Yeah.
And so if you've ever seen that omega quant where they you test what types of fats have you swallowed in the last 3 months, they're looking at red blood cells and they're trying to see, do you have any trans fats in your bone marrow? Do you have any trans fats in your red blood cells? And they measure that by this test that you give them your red blood cells and they run the analysis. It's a cool test.
It's really cool test.
Yeah, it's way better than a cholesterol test. This is what I say when you want to see if you're actually eating the kind of fats at the rate that you need to be. This is one of the core measurements that I have them do, and you don't need to involve me. You can go order the test on your own and get the results. And if you never want to tell me because they are awful, then you don't have to tell me either. It's you're in charge of and I really find that transfer of information, of responsibility is where we've sort of always been, that you should care about this. I can scold you, but that's not going to change your behavior long-term. Your insurance company can charge you higher money, but again, that doesn't change behavior long-term. That internal drive to be a healthier version of you, that's what we're trying to inspire in all this.
One of my favorite statements that you made at KetoCon is that you don't need a doctor to do the ketogenic diet. And, when you stop and you understand how intelligent the body is, you'll stop giving your power away to doctors. You'll see your doctors as health coaches guiding you to take the right steps, not as the end all be all to telling you what you need to do next. So
absolutely.
I love that.
And I think that the innovation of companies like Omega Quant and other ones that are out there saying, get the doctor out of the way. I don't want to be, any good doctor worth their salt is going to say, you got a problem? Let me tell you what I know about the human body and let me teach you. That education factor was always supposed to be number one.
Yes.
And you've now turned me into a robot that could match up symptoms and numbers and labs and numbers. It's an algorithm. You don't need me for that.
Right.
The education of showing you how to care for you, how to be in relationship and how to inspire people to change behavior. That is what a physician was supposed to do. And it's long been bastardized, I think.
Amazing. I always say, what I used to say to people all the time that, I'm not the doctor that stands up here and looks down on you. I'm the doctor that's going to link arms with you and we're going to walk together to where you need to go. And at the end of the day, we need people to know that it wasn't the doctor that healed you. It wasn't the medication that healed you. It's not even the ketogenic diet that healed you. You tapped into your body's own ability to heal you. And if everybody took their power back, we would have a whole different healthcare world. Don't you think?
Oh yeah. One of the best things that I know you do a lot of teaching on that I think links right into A1C is when people come back and they have a higher number than they think they should. I talk to them about, look, your body is designed to do some things you're not doing. And one of those is to go without food, to have the exercise inside your cells without food. Yeah. And, one of the most derailed conversations that I continue to see people have is that if you're a female and anywhere in that 30-40 reproductive range, you should not be fasting. And I keep thinking, no, your little ovaries don't want to be glycated any more than your red blood cells did. And that production of really good endocrine health comes with lowering the A1C. You cannot lower it any faster than what I practice in my life and what I encourage my followers to do, which is you should get to a metabolism. And not everybody gets there right away. Some people, took me a couple of years to fast every week, to have a fasting cycle once a week. We don't use the word fasting until you're at least 36 hours without food.
Cool. Now you're talking my language,
right?